Trachoma is an infectious disease responsible for approximately 3% of the world's blindness. According to the World Health Organization, there are about 8 million people irreversibly visually impaired by trachoma worldwide and an estimated 84 million cases of active disease in need of treatment if blindness is to be prevented. Few studies have been carried out in Uganda to determine the prevalence of trachoma, but the government felt it prudent to eliminate the disease in the riskiest districts. Here in Karamoja, children and women are the most affected by this contagious disease.
Because children always dwell together with mothers within the household, so the reserve of infection is common among those two, the children and women. Men are always out there looking after cattle. They may have a chance to go and maybe make themselves clean at the dams or in the streams.
Trachoma starts as an infection of the membrane that covers the outside of the eyeball and lines the inner surface of the eyelids or conjunctiva. Repeated infections can over the years eventually lead to scarring.
So when the upper eyelids become scarred, the eyelashes turn inwards and begin rubbing on the most sensitive part of the eye, and that is the cornea.
This eventually results in opaque, scarred corneas and distressingly uncomfortable eyes.
It eventually becomes white and somebody becomes blind.
Dr. Robert Mayeku says at that point one cannot regain their sight through antibiotic treatment unless they undergo surgery.
Because treatment can't reverse the damage which was caused over years of trachoma infection.
We visited Nabiratuk Health Center 3, Nakapiripirit district, where Dr. Robert Mayeku and other surgeons, supported by the Queen Elizabeth Diamond Jubilee Trust's trachoma initiative, are operating trachoma patients.
What was the burden initially?
We have a chat on how we progress today.
As per now, we so far have 8, which we have already worked on, but still we have more patients. But we take them slowly because they are very difficult. When you handle them anyhow, they run away. So we normally deal with them slowly. We need to take time. After getting one, you settle down, you talk to them slowly. So we don't talk to them in a group. We normally make a follow-up. And we have OCO, that is, those are the clinicians, ophthalmic clinical officer, that they normally follow up these patients. They move around their homes and they make sure that these patients are recovering well. If there is any problems that have come after surgery, they normally help them.
Dr. Mayeku says everyone has inherent trachoma, but the immune system fights the infection away. He further says that the increased infections in Karamoja are due to poor sanitation.
It is an area where people have been usually nomadic, so construction of fecal disposal facilities like pit latrines was not common. So what was common here was open defecation of fecal matter within the environment. And the flies which are responsible for the spread of the disease usually breed in fecal matter.
The consortium of partners, including Lions International, WaterAid Uganda, International Trachoma Initiative, among others, have been in this region to help it get rid of trachoma.
Our now strategy has gone to comprehensive eye care, total eradication, total involvement in eradication of blindness.
While celebrating World Sight Day in Nakapiripirit, the program director for Queen Elizabeth Diamond Jubilee Trust's trachoma initiative says their focus is to support surgeries, environmental improvement, and hygiene.
So it's encouraging communities to not defecate outside, but to build their own latrines, ones that they can maintain and keep clean.
However, with the existence of the initiative since 2007, there are prevailing challenges that need to be addressed.
We still have a water challenge. We still have education, which many people, children I don't think they go to school. We reached some place somewhere. They say all the taps which were, the pumps are not there. So we have to go very far to look for water. We don't have water even to cook. How do we have water for washing and all that?
A number of exhibitions teaching the surgery, antibiotics, facial cleanliness, and environmental improvements or SAFE campaign were held to benefit the community members.
On the F&E, which means face washing and any environmental improvement, you've moved around and you've seen there's a very big, remarkable kind of behavior change in the people. People are digging latrines, and also you can see the homes are actually much more cleaner. But of course now the challenge comes in on the part of hygiene.
We encourage all those who are funding plus the government to bring in water.
Karamoja is still one of the water-stressed areas in the country, and therefore such interventions can only do less than expected. Walter Mwesije, NTV, Nakapiripiriti District.